Hello. How are you? Oh, okay. You're looking for a big change, isn't it? Well, let's take a peek into your medical history. You want to get rid of your fillers? Is there a problem with them? You just want to go with a more natural look? Actually, it's the trend right now. A lot of people are dissolving their fillings. So let me just take a look. I have a very good memory, but it's not perfect, so I just need to check out what kind of fillers we put on you and the time exactly when we did it. Okay, let's see. It's been a while, yes. Have you ever had any issues with them? Pain, discomfort, itchiness? No? Okay. I do see here that we had an appointment quite some time ago to check on them. You had some inflammation. And I don't see any follow-up appointment for that. How did it go? It resolved on itself? Well, yeah, when that happens and if it resolves on itself as what happened with you, it's most likely what you have been eating that might make us feel a little bit bloated or look bloated, especially on the face. And in your case, it did look a lot in your fillers, right? Okay. I see here that you are currently in treatment for dry skin. How is that advancing? You're still in your treatment? Oh, that's great. Very happy to hear that. Yeah, normally it will take around 2 to 3 months to completely resolve if you keep doing the treatment, using the medication, the creams. I know, you are a very good patient with us. You always follow up. Okay, so let's inspect and assess your fillers. You want to completely remove all of them? Well, there are some new treatments coming up. We are going to a new convention in about 3 weeks. There are new treatments available that is going to be more natural, but still it's going to help the skin look younger, youthful. So you might want to look into that once we are back from it. Yeah, we can send you an email with the information if you want. Yeah? Okay, let me just set that up here in your medical history that we will input you so I don't forget. Tell my assistant. Okay. Now I'm gonna be drawing a little bit in your face. You know how it is. Okay. Oh, I do notice that our treatment for dry skin has been working. It looks very, very beautiful. Quite smooth. Okay. So the most noticeable fillers for you would be right here in this area, Also here. Now, in this part right here, it's not noticeable, but we do have fillers right in this area. When we had our appointment for the bloating, this is the area that reacted the most. So I do understand that you want to take this off too. Now we apply a little bit here, but this one's dissolved on itself, so there's no need to actually do anything. You want to improve your lips too? Okay, we unfortunately cannot do an enhancement for the lips and a filler removal because are completely different treatments and could actually damage the skin, so we want to let the skin rest for a bit after the removal. Okay, now we're going to take this out too on this area and here too. Let me see if I have them all. Let me pull out an old picture from when we did your fillers the first time. Okay, now I'm gonna be poking those areas with my fingers. Let me know if you have any discomfort, itchiness, burning sensation, anything, okay? How about here? Okay. And in this area? That's good. That means that your body completely accepts them. How about in this area? No, I don't see any signs of problems with your fillers. They look quite well. And you have them quite a lot of times, so they did its job. Now, I want you to know what is going to happen after I remove your fillers. Your face might look slimmer and might look like it's pulling down a bit. This is because the skin was large with the fillers, and once we remove this, it might take a little bit. For some people, it's almost instantly. For others, it might take a while for their skin to pull back to its natural place. This is something very common also on people that lose a lot of weight, or when people are pregnant, they had a baby, and their tummy sometimes takes a little longer to get back in its position. So we don't know if this is gonna happen to you because we have never removed them before on you. So these are what might happen in your skin. So you don't have a surprise when you look at yourself in the mirror the next day. This might happen, okay? But don't worry, it will get back to its normal again, okay? So, are you 100% sure we're gonna remove it today? Very good. So, for this, we're gonna be using a needle with a solvent that is completely removing this. We might have to squeeze a little bit in certain areas and might feel uncomfortable depending on what is your level of pain endurance. It really doesn't hurt that much, but for some people that are more susceptible, more sensible, it can be a little bit uncomfortable. If you want, you can apply a numbing solution in your whole face or the areas that we are going to be doing the dissolving. Okay, so let me just prepare myself and the items that we're going to be using. First of all, we're going to be applying the numbing solution. Oh no, it's quite fast, don't worry. But again, for some people it just maybe a little bit too much, okay? Start. Applying this directly. This is going to start feeling very warm, but not hot or burning sensation, okay? How are we going with the sensation? A bit warm only? Okay, that's good. It's very good. We're going to leave it in for a few minutes while I prepare the items that we're going to be using for the dessert, okay? I think with you, we're going to have to use 3 cc's for it. Again, you shouldn't be feeling any pain whatsoever, burning sensation, or anything like that, okay? Now, the needle that we're going to be using, it's extremely tiny. And it feels like a sting. You're not going to feel the pain or the sting. You're going to feel a lot of pressure into the area. And it feels kind of weird with the numbing solution that we apply. Just so you know, okay? Okay, now let's fill it up. As you can see, this is gonna go inside, and it has a needle quite long here, and when we press it, it's gonna come out, okay? Okay, this is ready. Let's see if your skin is ready for it. I'm going to be touching you with this. Let me know if you feel it, okay? Can you feel this? This. 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 Here? No? Okay. Now let's go with this one. It's a little bit more pointy. Again, can you feel this? You only feel the pressure, okay? But no other sensation, right? It does feel a little bit odd, yes. Okay, we're gonna remove the excess of the numbing cream. Okay. There's quite a lot in this area. Good. Very good. We are gonna start the dissolvent, okay? We're gonna be starting to feel the pressure and this weird sensation that I was telling you about. It might get stronger, especially on these areas, okay? I'll let you know once we are gonna go there. Okay, you ready? Good. 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 Okay, let me just bring you a towel. One moment, please. There might be some leaking. We want to protect your clothing. How are you feeling with it? Yes? Okay. Okay, here is. This is gonna protect your shirt. There we go. Okay, let's continue. Yeah, sometimes there's some fluid into these areas, not the filler itself. It's regular fluid from our bodies. That's why you notice some celebrities that have fillers done, that they overdo it. They look bloated. That's because all of the fluid buildup that they have in their faces. Yeah, actually, people don't really notice that they had it because they see on themselves in the mirror every single day. So they don't notice these changes that are very, very tiny but accumulate with time. So it's quite normal. Actually, your skin is reacting quite well. You had a lot of fluid, which is normal, as I was telling you, but your skin is actually receding and tightening as it should. You have good genes. Yeah, some other people with fluid retention tend to look even more bloated after the filler removal, and it takes a couple of days to look back to its normal self. There we go. Okay, we're gonna give it a little break. Want to see how your skin reacts. Quite nice. Okay, we're gonna do a little exercise. I'm gonna ask you to move your head like this to the side. Keep it like that. Okay, now to this side. Very good. This is so the skin gets tightening, and when I pressure, we can remove more of the fluid in the areas. But it looks very, very well. Okay, we can continue now. There are some new techniques for expression lines that, as I was telling you, it's already done, but they are not on the market right now, and I think they will look very, very good on you. And it has no fluid buildup. It doesn't make you look like you had something done, like sometimes it can happen with fillers. It's very natural. The thing is that it requires a lot of sessions for it to completely 100% work, depending on how many expression lines you want to remove or just soften up. For you, I would say 2 sessions will be enough. You have very beautiful skin and reacts quite well to the treatment, so there won't be a lot of problem with it. Okay, I have removed every single one of the fillers, and I believe most of the fluid that was on the areas too. I'm gonna apply this solution. This is gonna help with the swelling. There might be some swelling on the parts that I did the removal. Yeah, it's like a jade laid ball here. Feels quite well, huh? There might be some swelling on some people, and others not even a tiny little sign that there was something done. It's amazing how genes and skin work. I have had clients that the moment I touch their faces, it gets red. Yeah, very, very sensitive. Okay, it's good. How does it feel? No pain? Okay, that's great. You shouldn't feel anything like that. I'm gonna apply a little bit of warm mist just for your comfort. Let's see. There we go. Now, this is just on these areas. I'm going to be prescribing you a solution that I want you to apply every single night for the next week. This is to prevent any sort of infection or anything. It has happened to some people, but we found out that with this, it 100% prevents it. And there are just some drops that you apply in your hands and put it in your face at night. Normally just for 3 days, but I want to make sure that for a week is better. And there's no side effects to it. I'm going to put the instructions here. Quite easy, as I was telling you. And I would like to have a follow-up appointment just to make sure that we remove every single one. Let's say in a week time. Are you free? Okay, same day and hour? Okay, good. We're gonna call you beforehand to make sure that you're still fine with the time. Okay, now let's remove the excess. You wanna look at yourself? Okay, we have a mirror right here on the side. Isn't it? Yeah, you see these tiny dots? Yeah, that is gonna be gone in around half an hour. There we go. I'm pretty sure that there is not gonna be any signs of swelling or anything like that tomorrow. Normally for the patients that we have the fillers removed, it takes around 24 hours to start noticing this side effects, but I'm sure it's not going to happen. If it happens to you, don't worry about it. It's normal. It will go down for the next day. It's not going to be anything extreme, anything like the time that you came for that appointment of the bloating that you had in your face, remember? No, anything like that. It's just going to look a little bit puffy. I'm going to put instructions here in your information so you know if it happens what you can do. Okay, and that's it. Is there anything else that I can do for you? For the lips? Okay, we can actually do that in your next appointment for the follow-up. Well, it was my pleasure always having you here in our clinic. Thank you so much. And if you have any further questions, please call us. Of course, please take care. The creams and your prescription is gonna be here with my assistant in the lobby. Of course. Bye-bye. Hi. Nice to see you again. Let's take a peek into your file history. Okay. How did it go with our last treatment? Really? You saw good results? Oh, I'm so happy about that. I knew it was going to help you. It's always amazing how our skin changes when we give them what it really needs. Nurturing it. Okay. So we have your last treatment. Okay. Now the dryness, we seem to have it under control. And the fillers have been dissolved, so that is good. And you had an appointment for a lip profiling. Yeah, but that will be next week, right? Right now, you are here for acne extractions. Okay, let me see. Do I have you next week too for your lips? That's good. Okay, let me just prepare myself. My hair, thank you. Glad you like it. Kind of like The Little Mermaid. Yeah, I wanted to go with something more bold. I'm still not used to it, but I do like it. Makes me remind of The Little Mermaid. Oh, how I loved that cartoon when I was little. So tell me about the acne. What is going on there? You noticed that it started coming out? Have you had any changes in your diet? Introduce new foods, drinks, new skincare routine, besides what we gave you? A night cream? Do you happen to know the name? Okay, that rings a bell. Let me just make sure here. Okay, it's a generic brand. Oh, okay. Well, it's a good cream. The formula is good. It helps the skin, especially with dry skin, which is your main underlying issue. The thing is that this brand in a specific, combined with the creams that we gave you, going to like a fighting there. So you see all these breakups. Yeah, it's a combination. So the moment that you stop wearing it, the little pimples and the acne that you start noticing is gonna start just disappearing. But what we can do today is just remove the remnants here, and that will clear up the skin in preparation for when you stop wearing the cream. Oh yes, my little cat Miga. He's adorable. Don't worry, he's hypoallergenic. There's no hairs flying around, so you're completely safe. Are you allergic to cats? Oh, he started to purr. Okay, well, let's see. You're not wearing any makeup, right? Well, it seems that they are mostly located in this sections right here. I'm sorry about that. I had to take out the cat. It's in the other office. I have to have it here because he's taking some medication, so yeah, I have to keep an eye on it. So the acne is mostly located on those areas, and a specific that is telling us that it's definitely this new change that you added to your routine. Now luckily it looks quite superficial. Let's see. Does it hurt when I touch it? There's no swelling, so they are gonna be very easy to remove. Now, have you been scratching them, trying to take them up with your fingers? Okay, let me see here. Well, that's a big no-no for acne, because our hands, our fingers, especially our fingernails, are filled with bacteria. You will be needing to wash your hands every single night if you want to touch your face, because that's the perfect gateway for all the bacteria to go inside of our pores, and that's how the pores get clogged. let's start with a cleanser, okay? Now this one is one of my absolute favorites for this, especially for your underlying issue, which is the dryness. This removes absolutely any traces of dust, dirt, anything that you may have, bacteria too. There we go. It is a little bit greasy, yes, but believe me, it's magical. I'll be using one of this. We're going to apply this on the affected area first. Kind of like disinfected, but remember that our skin has also good bacteria that allows us and help us, because we need to shed all the dead cells, and if we kill that bacteria, that we'll be having this dead cells there without being removed, which the bacteria do is eat all that dead cells. Okay, let's give it a moment to start absorbing. I want to make sure that I see all the creams that you have right now. You still have some retinol. And I see here that the treatment still has 1 week left. How's that going? Fine? Okay. I'm gonna send you home with a cleanser too. Let me see if I have a sample here for you, because you only need to put it on for 3 nights. Should be enough, because you're not going to be taking that cream that you were using. With that, the breakage is going to stop, but we just want to clear up your skin. Okay, you have this one. So this is the sample that you're going to be taking home, and you're going to apply it at night before going to bed for 3 nights straight. Looking good. Very, very good. What I love about this one is that also remove the redness that some acne has. Very well. It's gonna feel a little bit cold, okay? Oh my god, yeah, he's been having some issues with his urinary tract. Male cats tend to have that issue quite a lot, and this one is especially susceptible to it. So yeah, I need to keep a close eye on it. Make sure he drinks enough water. Make sure that he is eating the right food. That's it. Okay. For the extractions, we're going to be using 2 cotton swabs like this ones. And we're going to be pressing onto the little pimples, okay? Now, the trick here is to be very gentle. We don't want to create any scarring tissue, marks, or anything like that. Especially for sensitive skin, this can happen quite easily. Okay, yeah, this is definitely an allergic reaction. So it's not hormonal, it's not dirt skin, no, it's just this collection of creams that are working together. Very good. Let me know if it hurts, okay? It shouldn't hurt, but if you feel that it's a bit too much, let me know. We can go a little bit more easy. Good. Yeah, what this cream that I applied earlier, it's bring up all the acne up, and is easy to lift up. I'm gonna press a little bit harder here. Yes, this is something that you can do at home, but it's important to know what type of acne or breakouts you have, because not all acne is the same and it doesn't work the same for the extraction. You can be creating scarring potential, so we must be very careful to do it, especially on an oversensitive skin. But this is better than doing it with your fingers, of course. Okay, that's good. Now let's apply this. You have a few blackheads here and there, but not too much to worry about. Those are normal. But this is going to lift them up. Very, very easily. Very good. Okay, let's sit in there. Now, do you have any tingling sensation? No? Okay, that's a good sign. That means it's completely an allergic reaction. I'm going to be setting this aside for you, okay? So we don't forget that you have to take it home. But I'm going to do a prescription with instructions on how to do it. But again, super simple. Before going to bed, clean face, you apply it just on the cheek area, okay? Just a tiny layer, like that. Wait around a minute or two before going to bed, because that way it's going to be absorbed and it's going to dry it out. Because if you go to bed right away and you put your head in the pillow, yeah, it's going to disappear. Let's take those blackheads out. Okay, looking good. Let's take it out. Beautiful. Actually, zero redness on your face, even though we did these extractions and I was applying quite a lot of strength into it. That cream, I'm sorry, this serum, this one, it's just magical for that. It heals the skin just magically. Well, the retinol, you can still use it, but I would like to take a little pause before continuing with that treatment for right now while you're using this one. So 3-day pause will be fine. Remember that with retinol, you don't want to overuse it too much. Don't apply too much because, you know, it can create a further problem. Very well. Let me just prepare the prescription with the instructions and the recommendation to pause the retinol too. Yeah, you can look at yourself in the mirror. I have one here on the side. Isn't it? It looks great. Now there will be no further, well, you might still notice a breakout or two, little pimple or two, maybe tomorrow. You're not gonna take the cream today, the one that you bought, okay? But that's from the last time that you put it on. So don't worry, with the cream that I'm putting, it's gonna dry up on itself. Just don't touch it with your fingers. Very good. Let's see. Okay, so now I'm gonna be applying a little bit of hot steam. This is something that I haven't done with you in a while. This one is different to the mist that I normally do with you. Okay, this is a little bit warmer. It's gonna be a little bit more strong. So don't worry. So it's just gonna be for a minute. It's gonna feel quite great. This is just to clear up the skin. Takes a little minute to start warming up. Feels nice, isn't it? That should be enough. Let's take a closer look again. You're gonna look a little bit blush. That's because of the warmth. Nice reaction. Beautiful. Very well. Okay. Let's just remove the excess what we applied. Now I will suggest you not to put anything in your face. I'm talking about makeup, hot creams, sunscreen, anything like that for the rest of the day. You want to have the face clean. At night, just wash your face with soap and water. Remember, no perfume soaps, especially made for the skin. Yeah, the syrupy, it's fine. It does feel fresh after that steamy. Okay, I'm gonna press a bit here. Very good. Okay, let me just finish your prescription that you can take home. Now you can put this in your purse. It's quite small, but it's gonna last you the whole 3 days, even a whole full week. But you just need it 1 week. No need to apply it more. Okay, do you have any questions?